Day, July the 13th. As you all know, that today we have stricter measures going into effect in 13 counties as we face down the threat of COVID-19. We have suspended elective procedures in our hospitals to prevent them from becoming overwhelmed. You know that I have pushed back in past months when people claimed that an increase in the number of cases was a spike in Mississippi. To my fellow Mississippians, I urge you to please make no mistake. We are in the middle of a spike today. In those 13 counties, we've put additional limits on social gatherings. We've said that masks are required at public gatherings and in retail environments. I'm asking every Mississippian to please join us in attempting to help us slow the spread of the virus. I hope that throughout this, people have been able to see me as an honest broker. I have avoided hyperbole at all times. I have never said anything in an attempt to scare people, only to plainly state what we are seeing. There are plenty of people who have said that we have not gone far enough. There are also plenty of people who have said we are going too far. I've always tried to show restraint. I've also taken steps I never imagined I'd have to take. I say all of that in hopes that people will trust me when I tell you this is the worst that has ever been for spread of cases in our state. It is the most stressed our hospital system has been to date. Right now, there is a backlash against coronavirus mitigation. It's understandable. The skies falling predictions of the spring were not realized. But we need to understand that that is partly because there were some who spun themselves up and could not control their rhetoric. But it's also important that we understand it is mostly because back then, just a few short weeks ago, we all took the coronavirus at least somewhat seriously. Some took extraordinary measures to protect themselves and their loved ones, but everyone was willing to do something. Right now, it seems like there's a good number of people who have resigned themselves to spreading the virus, or they believe that it is not real. I hear that all the time. I'm telling you, it is real. It is very real. You can see it in our death toll. We, as a state, are in the thick of things. The best way that we know to avoid the shutdowns of schools, sports, and work right now is to encourage you to wear a mask. I know that some people have trouble believing that. There was a concerted push at the beginning of this pandemic to discourage mask use from the highest levels of our government and from the highest levels of our health community. It makes guys like me, who are already skeptical by nature, have a hard time believing this time around. But I want you to know, I am here to tell you, I have directly asked every hard question you've wondered about. Why the change in tone? Are masks really effective? We've looked at every available tool. And I promise you this is the best weapon we have right now. It's not fun, but it's a hell of a lot better than widespread economic shutdowns. And if we don't do something, that's the trajectory that we are on. The president is wearing a mask. I'm wearing a mask. We're all doing it. It's got to happen, or we're going to find ourselves in a place as bad as we talked about in March and April, and as bad as we can possibly imagine. Scientists throughout this have sometimes gotten things wrong. Models have been flawed. Experts and pundits have been overly confident and overly dramatic at different times. That whiplash is confusing. I get it. It's been confusing to me at times as well. But I'm telling you, where we find ourselves today, this is not a hypothetical. We don't know the effects of this virus from experiments or from other states. We're seeing it right here, right now. The virus is deadly. It is spreading. In fact, our experts believe we are witnessing a more contagious strain tear through our state right now. It's above my level of expertise, but they've analyzed it. They believe that the virus is mutating, perhaps even more contagious, and maybe even getting more powerful. This is Mississippi's moment. This is our time to fight. I believe it's coming for every corner of this country, but it's coming at different times. This is our time. We are in the middle of our time. I urge you, stay calm, but stay in control. Do not panic, but persevere. We can beat this thing working together, and we can save lives. I would submit to you that that is what you are doing every time you choose to wear a mask. Every smart move you make, every sacrifice you make, every little action you take, the end result, you are helping to save lives. I believe in my heart we can do this. I also believe in my heart that we have to do this. We will come through this, but only if we are committed to one another. We will come through this, but only if we're committed to working together as one. Dr. Dobbs, would you please give us an update on our numbers?
Thank you, Governor. Today we're reporting 393 new cases for a total number of 36,680 coronavirus cases. We're reporting one death today and a total death count of 1,250. Keep in mind that likely represents a weekend reporting drop. Wouldn't count on this being a trend. Certainly we'll continue to follow this closely. If you look back at the data over the past several weeks about date of onset when people first became ill, you'll notice that on July 8th, we had by far the largest number of people reporting that they were ill at 1,071. Not coincidentally, that's exactly 4 days from July 4th and the weekend, and the incubation period is 4 to 5 days. So we're certainly very concerned that we're going to see ongoing cases related to holiday festivities. As a little bit of Mythbusters, I would like to go ahead and say a couple things real quickly. Every time you test someone, it doesn't matter. One person is one case. People ask me over and over again, if we test someone 3 times, does that count as 3 cases? Absolutely not. If we test someone 20 times, the same person is going to be just one case. So there is no case inflation for number of tests by individual. Please, we need to set that rumor to rest. The other thing is people have asked about is the antibodies. Are we driving up our case count with antibodies? Absolutely not. Of our total 36,680 cases, 285 are from antibody tests. So it's a small number, and it's only people who have a positive antibody test and either symptoms consistent with coronavirus or a known personal contact. So that's not driving up the numbers. It's coronavirus that's driving up the numbers itself. If we look at hospital utilization, it's something we continue to watch with great concern. We've had an increase in total cases hospitalized, 758 confirmed cases today with an additional 262 suspects for a total number of 1,020. If we look at our ICU utilization, that has increased as well to 208, and ventilator use has increased to 110. Again, things that we are not surprised about and predicted because the hospitalizations and deaths follow over time from when the cases start elevating. If we look at bed availability in the Jackson area, there are 4 hospitals currently with no intensive care unit beds available. In the state, there are 8 hospitals with no ICU capacity available. I would like to commend hospitals for adding capacity. 4 Mississippi hospitals have added ICU beds from their surge capacity and are staffing them to meet the need of Mississippi patients. This is something we'll continue to work on aggressively, and we're actually working on making sure we post information on our website about the number of beds and how many beds are available by region, ICU bed capacity, total beds, that sort of thing. I understand there's a great interest, and so we'll try to get that out to everyone very soon. We continue to work on our case investigation, trying to identify as many people as possible and get them on isolation orders and then quarantine orders for their contacts. Across the country, there has been a delay in testing, which undermines this effort somewhat because obviously if it's a 7 to 10 day lag, the person's no longer contagious by the time that we oftentimes find that result. But that's something we'll work aggressively on. The state public health lab has not been affected by that, as we've not had the same sort of influx of testing from hotspot states like Texas and Florida. Those have overwhelmed the commercial labs, and we've suffered for that. As you can imagine, we continue to add nurses and other public health professionals to our contact investigation teams and expect to see more from that as well. Thank you, Governor.